Hi, today we will discuss one video about careers in preventive care. This is a series of 3 videos. First is going to be the academics, second is going to be the clinicians, and third is going to be general public health. Those are the 3 areas that the specialists, that preventive care specialists, after they graduate, they work on those areas. And I'm going to explain showing what the graduates are doing, simply like that. So, success in the academics, DrPH in preventive care, the program that the world needs, Loma Linda University School of Public Health. The DrPH in preventive care was started or founded in 1972 by Dr. Mervyn Harding, and then in 1992, when it was 20 years, they changed the name to Preventive Care. Before was Doctor of Health Sciences. And then in 2022, we completed 50 years preparing prevention specialists. In 2020, we did the change in the program and put the program online. Here in these pictures, you have the famous guys that are professors and directors of the program. On my left, but on the top there, we have Dr. Mervyn Harding, the founder. Then we have here above me here Dr. Glenn Biggs, that the ones that changed to preventive care. Then in the bottom from left to right, Carlos Crespo, David Neiman, Hans Dill, Dr. Lee Burke, and Dr. Don Hall. Dr. Mervyn Harding was the founder. He died in 2010 with 96 years old, by the way. This program is old and was developed for people that live longer too. He is the founder and dean of the school from 1967 to 1976 to the School of Public Health. And then he was, until 1976, he was the director of the program for 4 years. And he had 2 PhDs in pharmacology and nutrition, pharmacology by Stanford, nutrition by Harvard. And between 91 and 95, he was the director of the Health Ministry's Department in the General Conference of the Seventh-day Adventists. And that's the time that I met the guy in Brazil, and I was not able to communicate in English with him unless I had a translator. And it was exciting for me when I came to America and I was able to meet him here in the School of Public Health, and we were able for the first time to speak in English together. Dr. David Neiman is, without any doubts, the best academic professional from the preventive care program. He is one of the top researcher in exercise in the world. We used to have a book in our courses, in our course of exercise, that we're using. We use his book for that course. He was also the vice president of the American College of Sports Medicine during two terms. Had nine publications and 9 books and 370 publications, and ran only 58 marathons. He was probably a director right after Dr. Harding, between 76 and 1976 and 1980. I'm not very sure about that. Another one that was a little more recent is Dr. Lee Burke. Lee Burke was graduating the program in 1981. After that, he worked in the medical center doing research. Since I know Dr. Lee Burke, I know he is doing research. His main research was about humor. and then humor and the immune system. Then he started working with the brain waves in the waves in the brain, and then he even did some research on chocolate and the immune system. He was the Associate Dean for Research in Loma Linda University School of Allied Health Professionals. And then, but unfortunately, he died last year. So it was a shock because this guy was a real good friend. My first job in Loma Linda, I got because of him. Dr. Carlos Crespo is another very successful story. He currently is the director of the Applied Health Sciences, College of Applied Health Sciences in Chicago, Illinois, University of Chicago, Illinois. He has more than 100 publications, was a member of the CDC, board member for years, and I believe he was working with the CDC now, is still a volunteer board member as I know. His expertise is exercise and diseases, metabolic diseases for the minorities. He was one of the participants in the surgeon report on physical activity and health, one of these years in the past. Ex-board member of the American College of Sports Medicine, got several NIH grants and graduated in 1989. Jocelyn Peterson. She was an ex-professor at Oakwood University. She graduated in 2009. She now is associate professor and director of the Nutritional Sciences School of Community Health and Policy at Morgan State University in Maryland, Washington. Dr. Brian Haddock is another one that is a success story. He graduated in 1998, and then 2 years before I graduated, we were good friends in the school. And right after he graduated, he was already teaching the students there, and he was my professor on exercise. And now he is the chair of the Department of Kinesiology at the San Bernardino Cal State University and chief of staff in the office of the president of Cal State San Bernardino. Edward Nathan, he graduated in 2012. He was here. I was helping him with his dissertation on that time. He was director of the Lifestyle Center in the Penang Adventist Hospital in Malaysia. One interesting thing is that he developed programs for smoking cessation virtual. The first online programs for smoking cessation was done by this guy in Malaysia many years ago. Now he moved to the Philippines, and he is the director of the Public Health Program at the AIAS University. AIAS is something like Adventist Institute for Advanced Applied Sciences in the University of the Philippines, and he started that last year. Gigi Walk Hensley. I know Gigi very well. We did a paper together a few months ago based on her dissertation about bitter taste and diabetes. The guys that have a taste for bitterness, they might be better off when they have diabetes because they will eat more foods that are anti-diabetic. She is a senior research clinical investigator for Amway. She practically only does research. And she also is a contract instructor for public health nutrition in the West Coast University in California. Her research is about supplements, foods, and beverages. She graduated in 2014. A few years ago, she came to Loma Linda and gave us a lecture on the supplement research that she was expert on. Kayona King is the one that is working for minorities, mostly the health disparities among African Americans. She is a professor, associate professor at the University of Nebraska Medical Center in the College of Public Health and Center for Reducing Health Disparities. She graduated in 2013. We are good friends, and she works very well when she was in the program as a student. Dr. Susanna Bick is from the group that we mentioned in the beginning. She is in Cal State, University of California, Irvine. She's a professor, and then she works in the Public Health Department of Population Health and Disease Prevention. She graduated in 1997, and she is a physician from Prague, Czech Republic. Dr. Michael Palani is my colleague. Michael was my student when he graduated in 2009, and he was the one that worked with me to build up a lifestyle center that we had there. And we are very happy when he came by a few years ago, maybe almost 10 years ago, that he is working now as a professor. So not only you can work in the academics, but sometimes you can work in the academics with us in the university, and that's the exciting part here. Dr. Palani is the director of the Masters of Science program in plant-based nutrition. And he works with us as the assistant director of the Preventive Care Research Group, and he teaches some classes for preventive care, for the Preventive Care Program. And finally is myself. I am a physician from Brazil, moved to America to do the MPH, the DrPH in 2000. Then in 2001, I went to Hong Kong, spent 6 years there. Then they called me, and I am here since 2007, about 19 years here. So I put here what the acronyms I have. I have the CHEST, the CNS. Well, let me explain what's that. CHEST is Certified Health Education Specialist. CNS is Certified Nutrition Specialist. ACSM EP is from the American College of Sports Medicine, exercise physiologist. And then NBHWC, National Board of Health and Wellness Coach. And I am a diplomate from the American College of Lifestyle Medicine. I put this just because if I don't have those things, at least half of those, if I didn't have, I would not get this job. So the job that I got as a director of the program or a professor was because I did all of those small certificates and have experience and have worked a lot with the community. I am a community person. So I am director of the program since 2014. And then I have 60 publications, and then I am a member founder of the American College of Lifestyle Medicine. So all of this is to announce that you guys can go to places once you start the program. And then if you need more information, contact me there, hdosantos@llu.edu. This is Preventive Care, the program that the world needs. Why? Because the program is focused on prevention of metabolic diseases such as obesity, heart disease, diabetes, and cancer, the main leading cause of death in the world. Thank you very much for your assistance. Call me, email me if you need any more extra information. Bye-bye.